Hi everyone. Today is Thursday, December 17th. I'm Dr. Wendy Fortna with your update on COVID-19 for Special Areas 2, in particular Hanna Area. As of this morning, we have 8 active cases in the Hanna area. None of these individuals are admitted to our hospital. As an update on our long-term care outbreak, currently we have no affected residents. We have 2 infected staff members who are recovering at home at this time. I have a lot of questions to get through this week, so I'll do my best. The first question's asking me, according to the government websites, when do people officially move from active cases to recovered cases? And the definition for that depends on whether it's a community patient or a hospitalized patient. If it is someone who's recovering in the community, they'd be moved into the recovered section 14 days after the date of swab collection. So even if they were symptomatic for 5 days before that swab was done, it's 14 days from the date of that swab. If the individual was in hospital, it's going to be 10 days after they're discharged from hospital or when their symptoms resolve with public health follow-up. So a little bit confusing and not necessarily super clear. So don't panic if you see somebody that you know had COVID and the number hasn't come down on the computer. They are considered recovered clinically 10 days after symptom onset, which doesn't necessarily correspond to the recovered cases on the Alberta government website. Next question, how come my volume of my podcasts are not loud enough? So just so you have an idea about how these videos get made, I get a whole bunch of questions from you and I sit down and I try to go through them and make sure I have the right and most accurate answers for you. And then one of our staff members here at the clinic just pulls out a phone and films me here in my office. So we don't have any special equipment to do these. It's sort of on the spot that we try to get these done for you to get them out as quickly as possible. If you're not able to hear on your computer and you have extra questions, you can always talk to your family doctor about it. Call the clinic, take a look at the Alberta government website, and all of this information is available there. But I'm certainly happy to take extra questions from people if you really can't hear me on these videos. I will try to enunciate as clearly as possible as well. Next one, does our hospital have a ventilator? Yes, we do have a ventilator, but it is not the same type of ventilator that they would have in the intensive care units. It's considered an emergency use temporary ventilator. So if we have someone who shows up to the Hanna Hospital emergency department and they're having a lot of difficulties with their breathing, we as healthcare providers can intubate, meaning put a breathing tube into those patients and use a ventilator to provide controlled breathing for them while we're trying to await transportation to a permanent facility for them, like Red Deer Regional Hospital's intensive care unit or one of the intensive care units in Calgary or Edmonton. So we only use it temporarily. Our ventilator also has the capacity to provide temporary breathing support for people who have COPD, also commonly called chronic emphysema or chronic bronchitis, if those people are in distress when they come to our hospital. And we actually use it for that more than we would use it for an intubated patient. So don't anticipate that anyone will ever be admitted to Hanna on a ventilator. We don't have the nursing skills or physician skills or the type of ventilator setup to keep patients that are that sick here at our hospital. It would be temporary use only. Before we acquired this ventilator, which was actually purchased with the support of the Hanna Ladies Auxiliary, we would have to manually bag patients with a mask if they were ventilated, or rather not with the mask in that instance, but having the bag connected to the endotracheal tube inside of the patient. It was very difficult to do that in the correct speed as well as the correct volume of air. So the ventilator has been a wonderful addition to our supplies, but definitely used on an emergency basis. The next question. So this one's a really challenging one for me to find the answers to. She says, as someone who works retail, I've had customers say they are exempt, or they will get a doctor's note stating for health reasons they are exempt from wearing masks. Is this true? The fines for businesses are quite high if we are caught not following the guidelines. How do we handle this? So I actually had to look up the official rules about masking in the Public Health Order, Section 23. And what they've said is that these rules don't apply to people who cannot put on, remove, or use a mask without assistance. Hence why children under the age of 2 don't do this. They can't take it off or use it successfully at all. As well, if people are unable to wear it due to mental or physical concerns. I've seen a lot of people that I would argue might not fall under these rules, but might for personal preferences not want to wear masks. But according to these rules, it gives a little bit more leeway for businesses. If they have people in their stores who are insisting that they are exempt from mask wearing, there's no piece of paper that they would need to show you for that. There is, however, an option of a private business being able to say that people who are not wearing a face mask or face shield are not able to be in that private place of business. But you should not be fined if there are people refusing to wear masks who are in your store. So don't panic about that aspect of it. As well, physicians have been given no direction or orders to require them to provide notes to patient. It seems to be a patient self-declaration. I haven't seen very many people overall refusing to wear the masks in the community, and even here in our medical clinic, it's extremely rare to have a patient show up who says that they cannot or are unwilling to wear a mask. If they do in our clinic, what we happen to do is we immediately put them into our COVID isolation room, even if they don't have COVID symptoms, in order to protect our healthcare workers. They are still seen here, but we have that extra layer of protection for everybody. All right, so I know this is a long one, keep with me here. So next one, with contract tracing being backed up or not happening, is everyone who is supposed to be isolating actually being able to do that? So as you heard, they're trying to get patients who are active COVID cases to do their own contact tracing now. And there are links that they will send you if they give you a phone call or a text message that give you that information. I was able to get onto it through the Alberta COVID website, and it's average. I'll say for people who are capable and comfortable with computers, it's fairly easy. If they're not, it's a little bit more challenging. So for some of my patients who are a little bit older or not comfortable with the computer, I've had them give me a shout, and I've helped them here at the office with the contact tracing to make sure that everybody who needs to isolate is able to. If other people aren't comfortable talking about it with their family doctors, they're still able to call 811 and request the assistance of an official contact tracer to help provide them with that support in getting all of their contacts notified. But if you are at home and struggling, please don't hesitate to let us know. We have the tools here and we can help you with that aspect as well. We want to keep our community members safe too, so don't hesitate to let us know. Next one, why don't they do a trial on the use of ivermectin for COVID, or why don't they use ivermectin in the treatment of COVID? So most of you aren't going to be familiar with the drug ivermectin. The only situations I use it in is for people who are infected with worms or scabies. So it comes as a cream or as a tablet for that purpose. I will tell you that right now there are active studies going on around the world. There is definitely one going on in the United States for patients who are quite sick but not severely sick. So these are going to be hospitalized ICU patients, typically who aren't intubated. There is a randomized controlled trial going on right now to see whether ivermectin makes a difference in the long-term outcomes and short-term outcomes for individuals with COVID-19 disease. So that has not been published, the results of that trial yet, but it is ongoing. Again, please don't go out and try to buy these medications for yourself. They are used under the guidance of trials only at this time, and if you require it, certainly infectious disease doctors will be able to provide that for you if they feel it is necessary. Okay, one update for you on the visitor policy up at our hospital right now. So if you are coming into the emergency department, you will be allowed one support person to be with you if necessary. So this can be the child of an aging parent, or it can be the parent of a child, or the spouse of an individual. If your complaint is relatively minor and you don't feel that you require a support person, or for example, something like a laceration, we ask that you do not bring extra people with you into the emergency department. We just want to minimize exposures where possible. Our long-term care, because it is under an official outbreak, we are requesting that anybody being an essential visitor is unable to book appointments. They would have to request special access through the long-term care manager. That's just during the duration of the official outbreak. So if you are the essential visitor, please make sure you just get in touch with the long-term care manager, and her and you will be able to discuss the necessity of that visit. The exception to that rule is going to be when a patient is palliative. If a patient is end of life, then absolutely we have a more liberal visiting policy so that family members are able to make their final goodbyes. Last one here, I promise we're almost done. So the town asked me to remind you that there is a program called Hanna Cares. It is a service that provides connection for those who have requests for check-in phone calls, snow angels to clean your sidewalks or driveways, curbside pickup and delivery of essential items. If you need assistance, or if you're able to offer assistance, you can go to hanna.ca/help, or you can call the town office at 403-854-4433. Again, that is for Hanna Cares. So we're in the final week before Christmas. My intention is to give you one more video next week, and I'm going to try to focus a little bit on the vaccine, all the questions that people have had about the types of vaccines and the side effects that are out there. I know there's a lot of misinformation. So if you want to send in any vaccine related questions that you have, I will prepare that video before Christmas next week. Otherwise, stay healthy and we'll see you again.